very good evening to all of you. Myself Dr. Prateek Garg. So today's topic is segmental innervation of face. Nowadays multiple question has been asked from this chapter, particularly the segmental innervation of face. So we all know the face, the sensory supply is by trigeminal nerve, and the motor supply or motor muscles, they are supplied by the facial nerve. So sensory is mainly by fifth cranial nerve, and the motor supply of the facial muscle, the muscles of expression, they are mainly supplied by the seventh cranial nerve. Now look at this diagram. We all know the fifth cranial nerve, that is the trigeminal nerve. The fifth cranial nerve, which is also known as trigeminal nerve, it consists of three branches. The first one is ophthalmic, the second one is maxillary, and the third one is mandibular. So what are the areas which are sensory supplied by these individual branches? So let's talk about firstly the ophthalmic branch. So the ophthalmic branch, it is supplying mainly, look at the diagram, tip of nose. Very important, has been asked previously, the tip of the nose, the sensory supply. Don't get confused that it is the maxillary nerve. No. So try to look at this diagram, the ophthalmic division. So we'll draw a line. Line start from the tip of the nose, going at the upper eyelid till the lateral canthus, then covering the parietal region, parietal bone. So the parietal bone of face, forehead, upper eyelid, and tip of nose. So these are the areas like the eyebrow, upper eyelid, tip of the nose, nasal dorsum. These are the areas which are being sensory supplied by the ophthalmic nerve. So important point, try to remember, tip of the nose or the upper eyelid, forehead and the parietal part. These are being innervated by the ophthalmic division. Then comes the maxillary division, which is the second branch of trigeminal nerve. So maxilla, it is line, let's draw a line from the angle of mouth, including the upper lip. So angle of mouth, draw a line which goes like this. So look at it, this diagram. So maxilla is supplying what? Upper eye, upper lip. Then comes ala of nose. Then comes cheekbone and lower eyelid. Lower eyelid by means of infraorbital nerve. So the maxillary division, it's supplying the lower eyelid, the cheekbone, ala of the nose and the upper lip. So this much part is supplied by the maxillary nerve. The third branch is mandibular nerve. So look at the diagram, mandibular nerve is supplying the chin, lower lip, the mandibular bone, and part of temporal bone by means of auriculotemporal nerve. Auriculotemporal nerve. So we all know, try to remember the pinna nerve supply. So pinna nerve supply, the anterior part of the pinna is supplied by the anterior and upper part of the pinna is supplied by the auriculotemporal nerve. So suppose this part. So this part of the pinna is supplied by the auriculotemporal nerve, which is a branch of mandibular division of trigeminal nerve. Okay. So the anterior part of the pinna, the chin, the mandibular bone and the lower lip is supplied by the mandibular nerve. Upper lip, ala of the nose, lower eyelid, and the cheekbone are supplied by the maxillary bone, maxillary division, and the upper eyelid, the tip of the nose, the dorsum of the nose, forehead, eyebrow, parietal bone are supplied by the ophthalmic division. And one more nerve is there, the greater auricular nerve. So greater auricular nerve is arising beneath the sternocleidomastoid muscle, and it is running like this, which is giving one the anterior branch and one the posterior branch. So this posterior branch is supplying the lower half of external pinna. So the lower half of external pinna is supplied by the greater auricular nerve, and the anterior branch goes inside the parotid tissue. Okay, and look at the neck. So this part of the neck is supplied by the transverse cutaneous nerve. The area which is the supraclavicular area is supplied by the supraclavicular, and posterior, we all know the pinna, the posterior half of the pinna is supplied by the lesser occipital nerve. Okay, let's look at another diagram which is particularly contributing for the trigeminal nerve branches. So this is the trigeminal nerve main trunk, then comes a trigeminal ganglion. From there the three branches arise. The first branch is the ophthalmic branch, which is supplying to the parietal upper eyelid dorsum of the nose, which is the area is lined by the green. Then comes the maxillary division with the area marked by the purple, which supply the upper lip, ala of the nose. This is the ala, this is the upper lip, and the cheekbone, lower eyelid, like this. And the last point is the mandibular division, which supplying the lower lip, the mandible, the chin, and by means of greater auricular nerve, it is supplying the anterior half of pinna. Okay, and also part of the temporal bone. This is again a diagram where we have written, we are having the different parts and areas supplied by the different branches of the trigeminal. Now, again a diagram to make you memorize in a better way. Like this, the ophthalmic division with the upper eyelid, and like this going, then comes a maxillary division, like this. Now the question is, which nerve innervate the skin here? Which nerve innervate the skin here? So suppose this is the mandibular area, mandibular nerve. So what nerve comes here? Supplying the lower half of pinna, the angle of mandible. So here angle of mandible is supplied by the greater auricular nerve. Don't get confused. The mandibular nerve doesn't supply the angle of the mandible. The angle of mandible along with the pinna is supplied by the greater auricular nerve. So this is again a diagram showing the motor and the sensory supply. The motor and the sensory supply. So we all know the motor supply is by the seventh cranial nerve, which is the facial nerve, by means of temporal, zygomatic, buccal, mandibular, and the cervical branches, which is supplying the motor muscles responsible for blinking, smiling, chewing, not chewing, the muscle of mastication. These are also the motor muscles. The muscle of mastication are supplied by the trigeminal nerve, whereas the muscles of expression are supplied by the facial nerve. So facial nerve supply the muscles of expression, whereas the trigeminal nerve is basically mainly supplying the sensory supply to the face and muscles of mastication. That is the pterygoid muscles, buccal, etc. Okay. So these are the different branches of the mandibular nerve, which are further the branches of ophthalmic, maxillary, and the mandibular nerves. And the facial nerve branches, there come the temporal, which is supplying the frontalis and procerus. Now tell me, which is the muscle supply, like the medial pterygoid and lateral pterygoid? These are the muscles which are supplied by which nerve? Facial nerve or the trigeminal nerve? The answer is trigeminal nerve, because the pterygoid muscles are muscles of mastication or muscles of chewing of the food or biting the food, so which are supplied by the trigeminal nerve. Now look at this other diagram where we can see the supraorbital supratrochlear nerve, which is the branches of the ophthalmic division of the trigeminal nerve. Then comes the infraorbital nerve, which is supplying the cheekbone, and it is a branch of maxillary division, and the mental nerve which runs in the mandible, that is a branch of the mandibular division. So mental nerve is a branch of third division, infraorbital nerve is a branch of second division of trigeminal nerve, and this supratrochlear and supraorbital, these are of ophthalmic division, that is the first division of trigeminal nerve. And the greater auricular nerve, it is supplying the angle of the mandible and the lower half of pinna, you can say C2, which is also forming the greater auricular nerve. So the angle of mandible and lower half of the pinna is supplied by the greater auricular nerve, and the posteriorly there comes the posterior branches, and above there is a lesser occipital nerve. Here comes a lesser occipital nerve. So I hope the segmental innervation of the face is pretty much clear. Now let's discuss about lymphatics from face. Let's have a basic idea. So let's draw a line crossing the eye going to till the angle of the mandible. So this line, the area above and the area below. The area above is supplying to the pre-auricular nodes, and the area below the angle of mandibular eye, the area below consists of upper lip, lower lip, maxilla, and etc. This is supplying mainly to the submandibular nodes, and the area of the chin and the lower lip, it is supplying to the submental lymph nodes. So this is just a basic idea. If examiner want to ask certain questions, so you can remember by this line. Just draw two lines, one line from the eyeball or eyelid towards the angle of the mandibular. So the area above is supplying to the pre-auricular nodes, the area below is supplying mainly to the submandibular node, except the area of the chin and the lower lip, which are supplying to the submental lymph nodes. Look at this diagram. If you draw this diagram, so these are the pre-auricular nodes, then come the submandibular nodes, and from the chin and lower lip, middle part of the lower lip, not the complete lower lip. If we examiner asks angle of lower lip, so angle of lower lip will be supplying to the submandibular nodes, but the middle part, any cancer of the middle part of the lower lip, so first lymph node will be involved will be the submental lymph nodes. Now let's have a proper idea of the lymphatic drainage. So firstly, the pre-auricular lymph node. So the upper territory include the greater part of the forehead, lateral half of the eyelids, because we are cutting the eyelid into two halves. So lateral half is supplying the pre-auricular, then comes the conjunctiva, lateral part of the cheek, and the parotid area. These all are draining into the pre-auricular lymph nodes. Whereas the median part is supplying the submandibular lymph node. Its area consists of the median part of the forehead, the medial part of the eyelid, then comes the medial part of the cheekbone, then comes the upper lips, etc., supplying to the submandibular, and the submental lymph node mainly supplied by the chin and the middle part of the lower lip, or the central part of the lower lip.